family. Golden penny is you. Golden penny is me. Golden penny is at the heart of the family. Oh yo yo yo. Golden penny 60.
Golden Penny Foods is celebrating 60 years at the heart of the family.
Heart of the family.
Hey, darling, have you ported your phone number?
Yeah, I did it yesterday, and I have been enjoying the new one. Actually, I regret I didn't do it way earlier.
Well, there is a new port in town.
What is that? Wait, can I port my car to a Rolls Royce?
Wifey. No, you can't port your car, but you can switch your pension fund administrator, PFA, to ICO Pension. This is made possible because the National Pension Commission has launched the RSA transfer system, which means you can also now enjoy the quality service I am accustomed to at ICO Pension. You have to do it immediately to avoid another regret.
Nice! This is the best news ever!
Yes, dear. To port to ICO Pension today, visit www.icopension.com/switch or call 0700 ICO PFA. And in no time, you will also enjoy their excellent customer service.
Yes, so Rose and ICO forever.
You see?
Someone is jealous. Okay, Rose and Larry together forever.
ICO Pension. Tomorrow's peace of mind starts with today's plans.
Hi there, I am Victory Yinka Banja and I got 9 A1s in all my subjects on my WIAC SSCE in 2020. And in my JAM UTME, I got a 335 out of 400. I really know how to pass exams. How did I do it? Can you do it too? Trust me, you can. Starting in February, I will be right here with you on radio every week, sharing my deepest success secrets and solving challenging past questions that will make you excel as a student, just as I have done. So, join me here on Splash FM, Monday to Wednesday, 5 to 5:30 p.m., Thursday to Friday, 4:30 to 5 p.m., and on Saturday, 3 to 3:30 p.m., and 4:30 to 5 p.m. Let us slay 2021 together.
Learn at Home is brought to you by Data Science Nigeria, partnering with the MasterCard Foundation.
Live on Splash 105.5 FM.
Politics is about taking part in the development of your environment. It's about contributing to the society. You can't keep quiet and let mediocres rule you.
Trending issues across the globe, giving it an in-depth analysis with seasoned guest, YS Live, with your host Yemi Sonde on Splash 105.5 FM, Tuesdays 10 to 12 noon. YS Live, politics.
The more we now reorientate people, the more people begin to see that leadership is not about do or die, and that politics shouldn't be about me, but we.
Sports, security, law, education.
It is only when the education of a country is well developed that that country can have the true development.
Entertainment, economy, health, business, religion, culture, environment, health, and fact files to widen your horizon. YS Live, Splash FM 105.5 Ibadan, 10 to 12 noon, Tuesdays. YS Live, English and Yoruba language.
Legally, you are the one constituted to be there as the authority.
For ad replacement and inquiries, call 0803 552 9883.
YS Live with Yemi Sonde on Splash 105.5 FM. YS Live.
YS Live.
YS Live.
Good morning. This is Yemi Sonde Live on Splash 105.5 FM, the Integrity Station. It's a Tuesday after Val. Well, I don't want to talk about Val, but of course I will not shy away from the fact that we need love to exist, to coexist. We need love. We really need love to live together as a big family, as one family. So for that reason, that may actually make me talk about Val. But of course, I'm not talking about Val this morning. I'm looking at health. This morning, we're not talking politics. We are talking health. We want to look into health. What are we talking about? And why is it so important to you and I? We will look into it, especially at this point in time. Why this time? Okay, we'll talk about that. I have my guests already seated. I have we've had overflow of guests. Originally, I planned for 3. I think I have another one, about 1 or 2 more. That's an overflow of guests. So that means we're going to really dwell on our focus this morning. What about it? Natality, morbidity, and mortality rate in Nigeria, a major challenge to achieving Sustainable Development Goal 3. What is Sustainable Development Goal 3? We look at that, and experts already in the house that would do justice to this. We'll talk about it. But in the meantime, let me quickly go through what we have as our headlines today. News headlines, Tuesday, 16 February 2020. 2020 WAEC withholds 5,548 results over exam malpractices. That's taken from the Vanguard. Yes, another one there. COVID-19. Edo records 103 new cases, 3 deaths in 72 hours, says official. Also taken from the Vanguard. Sunday Igboho is a child of circumstance. Governor Rotimi Akeredolu, taken from the Daily Times. Let me quickly take this. Governor Rotimi Akeredolu of Ondo State has condemned the Shasha market crisis in Ibadan, the capital city of Oyo State. The governor has called for calm and as well asked the residents of the Shasha area to desist from taking law into their hand. He made it known that the Southwest governors do not support violence, in particular jungle justice, unnecessary self-help, and brigandage. He commended the governor of Oyo State, Yemi Sonde, for promptly putting the crisis under control and imposing a curfew to prevent the crisis from escalating further. The governor noted that Sunday Igboho, who is being accused of causing the violence in Oyo State, is a child of circumstance. That the issue which led to each of the intervention in the state must be looked into and examined. COVID-19. Nigerian student expresses mixed feelings over virtual lectures, taken from the Daily Times. Virtual lectures. Somebody told me yesterday that what they have now in the universities is virtual lecture. Yes, it's fine. That's what they do in the Western world. But my concern then, when I was when she was telling me yesterday, was what I have in this paper now. Says lack of sufficient data. Yes, that's my concern. Poor internet facility affecting processes. Even if you have data, the internet facility, the network may be very poor. So I don't know where or how we'll get rid of this. In the Western world, it's virtual classes ever since last year, April or so, thereabouts. It's in March or April. Since about almost a year now, it's virtual classes and it's running smoothly. The tests smoothly, virtual classes. What do you call it now? Exams, virtual. Lectures, virtual, everything is on internet. But in this country now, I'm not sure if your phone internet is full as I speak. So if you move from one place to the other, some people would lose and even getting the data. So some students don't have money to buy data. Well, we'll get to the promised land, so to speak, one day. And the promised land is a land where is this land, the promised land is this land, and we'll get it improved where there will be no trouble, where we will live seamlessly without any issue, where we will promote love and kindness. We see ourselves as brothers, as one big family, and we eschew violence. And then the environment will be peaceful. Then there will be development. Good morning. This is YS Live. My name is Yemi Sonde. Like I said earlier, I have my guest seated already. You can join our online audience. Just want to the G. You can join our online audience by connecting with us on our Facebook pages. That's Splash FM 105.5 and Yemi Sonde Entertainment Limited on Facebook. Splash FM 105.5 and of course Yemi Sonde Entertainment Limited. Instagram at Splash FM 1055 at YSC Limited. Instagram at Splash FM 1055 and of course at YSC Limited. LinkedIn at Yemi Sonde. Twitter at Splash 1055. at Splash 1055. Visit our website, ysclimited.com. You can also subscribe to our YouTube channel, Yemi Sonde Entertainment Limited, to watch a recap of our programs. So contributions and questions are welcome, and you can send them to hello@ysclimited.com. YemiSondeLive@gmail.com is another email address. Kindly remember to use the hashtag YSLive for your contributions. Natality, morbidity, and mortality rate in Nigeria, a major challenge to achieving Sustainable Development Goal 3. My guest is the president, our own president, JCI Oluyole, yes, president. That's Onome Oziegbe. Oziegbe is from which part of the country?
I'm from Edo State.
Edo State?
Yes.
Oziegbe.
Yes, Ekoma to be precise.
Yes, I know some Oziegbe. I know Oziegbe. There's this Oziegbe that in Ogun State that I know. One, yeah.
It's actually a big family.
Okay. It's also from Edo State.
Okay.
Yeah. Anyway, we talk about that later. Okay, now, good morning, President.
Good morning, sir. It's nice to be here.
Yes, Dr. Ibishola Babashola is a regular customer. Dadani. It's a regular customer on this program. A regular guest, yeah, especially when we have to talk about health. He's always around and he makes himself very available. Thank you very much for supporting this program. Dr. Ibishola Babashola, family physician, University College Hospital, Ibadan. Good morning, sir.
Good morning, sir. Good morning, listener.
Advocate of United Nations Sustainable Development Goals, National Veterinary Research Institute, VOM, JOS, all the way from JOS. Dr. Ibukunle Faramade is in the house. Good morning.
Thank you very much. Good morning. Good morning, listeners.
It's nice having you.
Thank you very much.
We'll get the name of the Dr. Adeshino. Academy Hospital. Okay, Dr. Adeshino is there. Okay, I'll come to you, Dr. Adeshino, much later. Yes. What are we talking about? Natality, morbidity, Desmond to the G, Progress Man Media, no go. Damola Ologun Fegan, producer Alabenu, to Shagugu, Mola, and Rashida Ugo. We are not finish. Sustainable Development Goal 3 of the 2030 Agenda for Sustainable Development is to ensure healthy lives and promoting well-being for all at all ages. Listen again. Ensure healthy lives and promoting well-being for all at all ages. Okay, how do we ensure this is achieved? What are the challenges? Can this be achieved? To ensure healthy lives and promoting well-being for all at all ages. Maybe I should start by what is natality for the benefit of the Desmond to the G's, morbidity and mortality rates. What are we talking about? Mufeka Foswe when you Tori and Yami to and Leti Boimbo. Bonikin Tibere, Shadow the president in Tibere near Bodo Doctor Wambi. Should we start from the lady in the house? Or we start from anybody? Okay, let's have it.
Okay, when we talk about natality rate is about the birth rate in Nigeria. The birth rate, how it affects when you're giving birth, before a woman gives birth to a child, and after the woman gives birth to a child, the risk that is involved, and what eventually happens before the child gets to age 5. That's the natality rate. What is the obstacles that the pregnant woman goes through before they give birth to that child?
Okay, you can't speak Yoruba. Sorry. Let me speak with somebody that can. I'm coming back to you.
Okay.
I'm moving first. I want to break it down.
Okay.
Yes. Should I start from here now?
It's all right.
Okay, let's have you.
Yoruba.
Yeah.
I want to nípa ìgbéléwọ̀n bíbí àṣẹ bímọ sí láàrin àwùjọ wa. Pàápàá jùlọ láti ìgbà tí obìnrin bá ti wà ní àsìkò àti lóyún títí ìgbà tó bá lóyún àgbà tó bá bímọ. Ìyẹn làwọn olóyún mọ̀ pé maternity rate. Tàbá tún lè sọ ní common English birth rate. Kí ni ìwọ̀n ọmọ bíbí láàrin àwùjọ wa? Láàrin àwùjọ ìtumọ̀ natality rate nìyẹn.
Okay, mortality ńkọ́ àti morbidity.
Mortality bá ṣe ń kú, ìgbéléwọ̀n iye àwọn tó ń kú láàrin àwùjọ, pàápàá jùlọ la gbé wọn lórí ìwọ̀n bíi láàrin ọgọ́rùn-ún tàbí láàrin ìwọ̀n ọgọ́rùn-ún láàrin àwọn àwùjọ ènìyàn báwo la ṣe ń kú sí àwọn ọmọ wẹrẹ ni wọ́n ń kú jù ni àwọn tó wà ní àárín gbùngbùn ọjọ́ orí ni wọ́n ń kú jù ni àbáwọn arúgbó ìyẹn wọ́n pè ní mortality rate morbidity rate ó pé báwo làwọn èèyàn ṣe ń ṣàìsàn sí àìsàn ṣíṣe láì tí ì dé kó la ikú lọ òun ni morbidity báyìí ṣe ń ṣèyàn kó tó di pé èèyàn kú láàrin àwùjọ èèyàn bá kó èèyàn bíi ẹgbẹ̀rún sílẹ̀ ìgbéléwọ̀n láàrin àwùjọ wa àyàn mélòó ló ṣeéṣe láti kó àrùn ìyẹn ni morbidity rate wà ní í ṣe pẹ̀lú oríṣiríṣi àrùn tábà ní ká sọ̀rọ̀ nípa bóyá Dr. Bisola máa sọ̀rọ̀ nípa ayé dáadáa nípa àwọn àìsàn tó ń ṣèyàn bóyá tuberculosis ni o bóyá HIV ni o àti bẹ́ẹ̀ bẹ́ẹ̀ lọ bóyá nípa àìsàn ọmọ wẹrẹ bóyá measles ni o bóyá diphtheria ni o ìyẹn la máa fi sórí àìsàn kọ̀ọ̀kan.
Yes, you were saying something. I allow them to speak in Yoruba. Yes, the president. You're talking about natality. You've explained that.
Yes.
Mortality and morbidity.
Okay, the mortality rate is the death rate. The death rate of an individual compared to the birth rate. It's practically about death. Now, there are so many factors that causes mortality rate, and that is the morbidity rate. That is the effects of the treatment that actually cause this thing to happen, cause death to happen. Like maybe you have an illness like cancer, HIV. Now, the effect is the treatment. If you are not treated properly or diagnosed early, you can eventually die. But when you have this disease and then at the end of the day, you are treated, you're diagnosed, and you are followed up by a doctor or a nurse, you can actually live for a very long time. But if those things are not in place, you can actually die from it. So that's the morbidity rate.
Now, talking about SDG Go 3, how do we ensure we achieve this? The government should be involved. Well, don't let me talk for. Let me allow you to talk about it now. How do we ensure? How do we achieve that Go 3?
Okay, Go 3 talks about good health and well-being for all at all ages.
At all ages.
Okay, now, like now, the government. Let's say the government will have primary health centers all over the country, but the rate at which the health centers are functioning is not really going to work with this SDG goal. It's not working.
Do we have health centers?
Well, I would say we have health centers, but the effect of the health center, are they working? Are they in good place to actually make this mortality rate reduce? That's what we're talking about here, because yes, we have health centers, but most of them are not working.
I'll come to your experience with these health centers. Dr. Bisola, do we have health centers, functioning health centers?
Well,
you can come closer to the mic.
That's a very big question. We do have health centers, but obviously not enough quantity that is expected for the population. There's a minimum or maximum distance that an individual is expected to travel when you are seeking for health care. I mean, on average, ideally, in every ward, there should be a clinic or a primary health care center where, if I have an headache, I can readily walk up to the clinic, and be attended to. We really don't have that, as it were. The few that we have, which is what she was trying to touch on, they are not optimal in terms of personnel, in terms of equipment that are needed to meet the need of the populace. They are not optimal. We do have, but not enough.
We do have, but not enough.
Yes.
Okay. We'll go for this short break. When we come back, we'll expatiate on this health center. We look into how many do we have on the average. We may not have the accurate figure. How many do we have on the average? JCI, I'm sure you must have had one or two experiences with the health centers. We talk about that. And of course, we now look at how do we improve on these? Because achieving this SDG Goal 3 start from the health center functioning. But where we don't have, then we're talking about mortality rates. Don't you think it would get high? The rate will get higher and higher. Definitely. If we don't even have a functioning health center, not to talk of a hospital. We come back after this short break.
Yellow! ìkéde pàtàkì lélẹ́yìí o fún ẹ̀yin oníbàárà wa ọ̀wọ́n tí ẹ kò tí ì ní NIN tàbí tí ẹ kò tí ì so NIN yín pọ̀ mọ́ àwọn ìlà MTN yín gẹ́gẹ́ bí àṣẹ láti NCC MTN yóò máa so National Identification Number NIN yín pọ̀ mọ́ àwọn ìtanilólobó àkọsílẹ̀ ìforúkọ síìmù yín tẹ́ ẹ ti pèsè tẹ́lẹ̀ kó lè rọ̀ yín lọ́rùn ọ̀nà méjì rèé láti ṣe é. Ìkíní ẹ lọ sórí My MTN app. Ìkejì ẹ pè *785*NIN#. Tí ẹ kò bá ní NIN ẹ lọ sí www.nimc.gov.ng láti ṣàwárí ibùdó ìforúkọsílẹ̀ tó súnmọ́ yín láti forúkọsílẹ̀. Ẹ jọ̀wọ́ ẹ rántí yàtọ̀ sí ìlà tí ẹ fi ń pè gangan ẹ gbọ́dọ̀ so NIN yín pọ̀ mọ́ gbogbo ìlà yín yòókù àti àwọn síìmù dátà yín bíi MiFi, iNetflix àti àwọn mìíràn tí ẹ máa ń lò lórí àtàgbà MTN. Ìkéde yìí ṣe pàtàkì.
O gbọ́dọ̀ ṣe ìsopọ̀ gbogbo àwọn síìmù rẹ kó tó di ọjọ́ kẹfà oṣù April ọdún 2021.
Oh, lunch. Guys, I'm going for lunch. Please, put more stew. Nice meal. My chest.
Suffering from heartburn and indigestion? Try Just Eat. My recommendation for the past 26 years. Just Eat is a brand of aluminium and magnesium hydroxide and simethicone. Just Eat is available in suspension and tablets. Remedy for heartburn, indigestion, flatulence, and acidity.
Just Eat, now available in new packs. If symptoms persist after 3 days, please see your doctor. Read leaflet inside.
Excuse me? Yes, I'm talking to you. You who always wants to give your family the best things. I know you love this exciting DSTV decoder bundle offer. Instead of 18,600 naira, you can get a new DSTV HD decoder plus 1 month DSTV confirmed subscription for a lower price of 9,900 naira. Yes, you heard me right. A brand new DSTV HD decoder plus 1 month DSTV confirmed subscription for a lower price of 9,900 naira. If you've always wanted to give your family amazing entertainment, then this is your time. Offer starts from February 1st for a limited time only. Terms and conditions apply. DSTV Nigeria. It's your moment.
Now, where's that big malt? Today was just one of those days. You know, woke up by 5, made breakfast, went to work, did my job, then my Oga's work, then Oga's work, came home, made dinner, and now nothing can stop me from enjoying my rich, smooth, refreshing Dubic malt.
Enjoy the silky smooth taste of Dubic malt. Dubic malt, crown the moment.
A fully furnished, nice and comfortable hostel accommodation in University of Ibadan, or a place for seminars and executive trainings at the same venue? You do not have to worry. Adebayo Akode Hall suits your lodging needs and provides you a home away from home. Adebayo Akode Hall is a 4-star hostel built in a serene environment with constant supply of electricity. It has fully furnished rooms that gives you great comfort at an affordable price. Adebayo Akode Hall is located at Ajibode Extension, University of Ibadan. To make reservations, visit www.adebayohall.com or call the numbers 0805-699-8718, 0805-699-8719, 0805-699-8720. Adebayo Akode Hall. Built for comfort. Built for you.
$2020 ń lọ sópin. 2021 á dára.
Ó ga jù. Ọdún yìí ojú mi rí màbo. Ọdún tó ń bọ̀ gbọ́dọ̀ dùn.
Ọmọ ọdún tó ń bọ̀ ní láti dùn ṣáá ni. Mo gbọ́dọ̀ make ẹ̀.
Òótọ́ ni o, nítorí láti oṣù kejì ọdún títí di oṣù kẹrin ọdún 2021, èèyàn 8 ni yóò jẹ mílíọ̀nù kankan náírà. Tẹ́nì kọ̀ọ̀kan nínú èèyàn 180 yóò jẹ ẹgbẹ̀rún lọ́nà ọgọ́rùn-ún kan náírà níbikíbi lórílẹ̀‐èdè Nàìjíríà lásìkò ìpolongo oríire Polaris Save and Win. Láti yege, ṣáà ti máa fi ẹgbẹ̀rún 10 náírà tàbí jù bẹ́ẹ̀ lọ pamọ́ sínú àkáǹtì rẹ lóṣooṣù fóṣù 3 léraléra bẹ̀rẹ̀ láti oṣù kọkànlá ọdún yìí. Ìyíkoto yóò bẹ̀rẹ̀ láti oṣù kejì ọdún 2021. Torí náà yára tẹ *833# kàn sí wa lórí ẹ̀rọ ayélujára pẹ̀lú polarisbanklimited.com tàbí èyíkéyìí ẹ̀ka Polaris lórílẹ̀‐èdè yìí láti ṣí àkáǹtì rẹ. Tó o bá ṣe ń fowópamọ́ sí láyé láti jẹ̀bú ó ṣe pọ̀ sí. Ìpolongo oríire Polaris Save and Win yóò máa tẹ̀síwájú láti ìsinsìnyí títí doṣù kẹrin ọdún 2021. Òfin àti ìlànà wà o. Fún àlàyé sí kàn sí wa lórí ẹ̀rọ alátagbà wa lónìí.
There's no hurt or sorrow.
YSLI.
There are ways to get there. If you care enough for the living, make a little space, make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. If you want to know why.
So, we're talking about health centers. The JCI president, you wanted to give me experience. What is the rates? Health centers, do we have enough that we should? Dr. Bishola said no. The few ones that are available, are they actually functioning? At what rate to what rate?
Okay, my experience with health center, a particular one I have, we're currently working on, is in Abanla community. They have a health center there, but it's not functioning. Now, for the past 4 to 5 years, JCI has actually been going there to give the people in the community medical treatment once in a year.
As a non-governmental organization?
Yes, as a non-governmental. That's basically what we do. We seek a need in the community, and we look for available limited resources to fulfill that need. So we went to Abala community 4 years back, and we discovered that their primary healthcare wasn't working. So we decided, okay, let's do something for this community. We started having a medical outreach every year, once in a year. We take in doctors, we take nurses, we take drugs, and all the medical facilities there to treat, examine and treat the people of the community once in a year. That's what we do. So we have partners with hospitals and pharmaceutical companies that do that every year. So to make this project actually sustainable, we now feel like, okay, instead of going in here once in a year, why don't we work on the primary health care? Let us actually make it work. So that instead of us coming here every year, let's actually make that primary health care. Because basically it is a terrible experience when you go there and you see children sick for weeks and no treatment.
No doctors.
For them. No doctors.
No nurse.
No, they can't afford the treatment. They can't, because they have to leave the community to another place entirely to get medication if they want to.
Is it just an open place, nobody to attend to them or something?
Well, we had a feasibility study when we got there. We met a woman that usually, I think she gives the treatment. I think she's the only one there, and one other woman that volunteers. She's been volunteering for the past 8 years, and she's not being paid. She just volunteers. She
At where?
In the community. At Abanla community. At Oluyole local government.
Oluyole local government?
Yes.
Abanla community?
Yes. So we went
the
there.
health center serves how many communities there?
3 communities. Idia depends on that community. Ayekpe depends on that community. And Abanla itself depends on that community.
On that one
primary health center.
Primary health center?
Yes.
And it's not functioning?
And it's not
You
functioning.
just have a volunteer and
one other
maybe a nurse or something?
that can just do the little she can. Because they are much in the community anyway. They are much. So she can only do the little that she can. So we, as an NGO, we said, okay, let's do something for them. Let's. Why is it not working?
Is that children sick without being attended to
Yes.
for weeks?
Yes. There was a year we went for this medical outreach, and a baby girl was sick for over a week. She had malaria.
Wow.
The parents couldn't afford treatment. The primary care is not working, so there's no way they can give her treatment anyway, even if they wanted.
They had no money to buy malaria drug?
Yes, and the healthcare wasn't working for them to actually do that. So
So what happened to the child?
Okay, we tested the child because we went with doctors and nurses. So we tested the child and gave the child medical treatment. So assuming we didn't go there that very day or that year, we didn't even go there, what would have happened to that child? Who knows what would have happened to many others just like her? We don't know.
So the primary health center has no medicine,
It doesn't. So what we do...
The beddings...
The beds are not... I actually have pictures of those beds. The beds are not in place. Nothing is working there. You can just walk in. It's just like you just dump something. Then nothing is working. The roof is leaking. The floor is messed up. The toilet. Even the children's section. There's nothing there. There's nothing that is working there. Nothing is there. It's dusty. Beds coming from the roof and pull on the bed.
Beds?
It's terrible. They come through the roof and pull on the beds. It's terrible. I have pictures as evidence. Now, as if we are making these things up. We go there.
I hope the Commissioner of Health in Oyo State. I hope the Commissioner of Health in Oyo State is listening to this. Okay, let me have more.
Okay. Okay. We said, okay, let's start renovation. We started renovation last week on the healthcare.
The government gave you money?
The government did not give us money. We are an NGO, so we always source.
I want to be very sure.
The government did not give us any money. The government don't give us money.
Government don't give you money.
We seek partners.
So what's your concern?
Our concern is that as an NGO, that's what we do. We seek a need and we fulfill that need with limited resources available to us. That's what we basically do.
Have you ever got in touch with the health commissioner or commissioner for health in Oyo State?
We went to the secretariat and we drop letters. They'll keep moving you from one office to the other continuously. They move from you just get tired of everything and just do little that you can.
What letter did you drop at the secretariat?
We wrote a letter that we'll be renovating the primary care health center and that we need partnership. We don't actually need money. All we need is materials. We need partnership. We need it to work. We need collaborations with them.
Did you submit it at the Ministry of Health or something?
We submitted the letter, but we haven't gotten any response.
Where did you submit the letter?
We dropped the essay to the state government. We dropped letter there. We drop letter at Ministry of Health to inform that this thing will be coming. We'll be having such this thing, just like we're dropping letter to individuals that will have this project ongoing and we need support. We only have private companies that partners with us that actually make this thing work.
Dr. Ebukuli, are you worried?
Very worried because if I may share my personal experience, a few years back I was traveling Ojo en route Oyedeji to Ewo. Unfortunately, I met some women flag me down, by the roadside, troubled with their child. Because if I can remember very well, the boy should be about 8 years. That I should assist them. So I parked and assisted them carry. What happened? The boy convulsed, and there was no any form of health center within the vicinity of that area. I'm talking about Oyedeji, going to Akatere. Now, I assisted to take that boy to Lagun. Unfortunately, before we got there, the boy had passed on. And when we got there, we met a nurse that tried to do one or two things, but you really know yourself that nothing is likely to happen here because of the state of that comprehensive health center at that time. So we are really in a serious crisis situation when we are talking about the issue of achieving SDG 3. But let me quickly add that we are not likely to achieve SDG 3 if you are not tackling the whole SDGs because they are really interwoven and the fulfillment of one overlaps into the other. Now, achieving SDG 3, concerning the comprehensive health center, primary health center we're talking about, that's just an aspect. There are so many targets. I think we have about 8 targets under that SDG 3. One is talking about reduction of mortality, maternal mortality. One is talking about reduction of under 5 mortality. Another one is talking about reduction up to half of road traffic accidents. Now, if you look at those 3, now how are we going to ensure that there is a reduction in maternal mortality without education? And education is SDG 4.
Yes.
Talking about improving access to education, particularly for women and girls, and making sure that there is no gender disparity in access to education. Now, because if findings have established that educated women do not undergo the same kind of experience that uneducated women encounter, particularly when you educate a woman. No, I'm not talking about university education, I'm not talking about technical education, basic education, so that the woman knows that it is very important for me to report when I'm pregnant, so that I can be clocked, I can be checked routinely, so that real monitoring of the period of pregnancy will take place under controlled atmosphere, not using of unverified kind of medication, self-medication, a lot of herbs. We're not condemning herbs, but those that you don't even know how it works. So when you attack education, when you frontally educate the woman, you are able to really also reduce maternal mortality. And also issue of a reduction of mortality of under 5. It has to do with nutrition. Because if a woman is not well fed, we are talking about a woman to...
I think SDG Goal 1 caps all. That's no poverty.
No poverty. Banish poverty.
Because poverty is everywhere. You cannot... provide good health to your family. That's poverty. You cannot eat good food. That's poverty. You could not send them to school. That's poverty. I mean, poverty really
overlaps into all those.
So SDG Goal 1 is a major one for the government.
Exactly, to tackle.
Exactly. It's a very great one for the government. And we have about 17. Yes. And 3 is, we are talking about good health.
Good health.
And 4 is education. Then 5 is gender equality, inequality, equality. Now, looking at all these, there is no way we would say we want to single-handedly tackle one, leaving others.
It is not possible. It is not just possible. And, one of the reasons why we have to, particularly the people at the government authority, have to take this very seriously is that this is not the first time of having set of agenda to fulfill within a period of time.
Yeah.
The year 2000, there are these MDGs, 8 goals that let's ask ourselves, why did we need to subscribe, or why did the world come to conclusion that there's supposed to be another target or another SDG? Why?
When the MDG are not even
they are not fulfilled. It's documented that even though it was really put up so that there can be kind of equality across the world, we found out that it is so-called developed countries also that really achieved the MDGs. So now, in order to give sub-Saharan Africa and Asia, particularly where poverty domiciles so much, another chance. They now come together, head of government, 2015. Let's set another target between 2015 and 2030. That if we can encourage the government of all the world, particularly sub-Saharan and Asian country, to make sure that between this goal 1 and 17, they work together to achieve it. You find out that they will bridge the gap of poverty, bridge the gap of education equality, bridge the gap of maternal mortality and neonatal mortality we're talking about health and stuff. At the end of the day, there will be reduced migration or need to rush from one place to the other because everybody is having access to quality life. So it is really difficult to attack or to tackle one at the expense of the other. But just as I have said, if you are able to tackle one, the SDG 1, you have really because measures that will reduce poverty, as taking care of education, as taking care of health, as taking care of water and sanitation, energy and infrastructure, and so on and so forth.
There's this viral video on social media. That video got me thinking, and you feel, why should a grown-up woman like this leave the country to do what she's doing wherever in the Western world? And the answer is just very simple. In this country, there's poverty, there's all this that we said, no good health, no security, this, that. You wonder why, I don't know if you saw that video, a lady cleaning the dishes and the old is it grandma, one grandma, white old mama, was spitting on her and frustrating her. And she could not even. She was just stop. I said you should stop. I said look at this woman. the trauma, the psychological trauma. Yeah, she's facing those things and swallowing them because of those. Those shame and swallowing them. What they could not do in Nigeria, they were doing it abroad. I'm sorry, I don't mean to spite anybody, but when you look at the condition that Nigerian men and women live in the Western world, you tend to ask questions and say, why are you there? Why are you subjecting yourself to this slavery, secondary slavery or something? This level of dehumanizing and all that. But you could not say anything. If you touch that woman, you are going to be charged to court. If she spits on you and you can't, somebody's spitting on you and
you can't do anything.
You can't do anything. Then you want to now ask questions that why should you, because one, we don't have good health. We don't have power, we don't have security, we don't have food, we don't have infrastructure, we lack no employment, there's poverty. A lot of people that are there are not happy being there, they want to come back home, but what are they coming back home to do? Ibishola, I'll come back to you after this short break.
Excuse me? Yes, I'm talking to you. You who always wants to give your family the best things. I know you love this exciting DSTV decoder bundle offer. Instead of 18,600 naira, you can get a new DSTV HD decoder plus 1 month DSTV confirmed subscription for a lower price of 9,900 naira. Yes, you heard me right. A brand new DSTV HD decoder plus 1 month DSTV confirmed subscription for a lower price of 9,900 5,900 naira. If you've always wanted to give your family amazing entertainment, then this is your time. Offer starts from February 1st for a limited time only. Terms and conditions apply. DSTV Nigeria. It's your moment.
Some energy drinks promise power, but are more like this. What you need is this. New Predator Energy Drink. Rule your kingdom. Now sells for only 200 naira.
Brace up for the future. Study nursing, doctor of physiotherapy, medical laboratory science, accounting with ICANN professional certification, mass communication, criminology and security studies, software engineering, cybersecurity, biotechnology, and other relevant courses at Christland University, Abeokuta, the university arm of Christland Schools. Christland University is a world-class university with state-of-the-art laboratories, libraries, studio, entrepreneurship certification, and good accommodation within a conducive environment for learning. At Christland University, transfer to 200 and 300 levels are available at affordable rates. Top-up conversion programs are also available. Our upcoming program is law. Our fees are affordable with flexible payment plan. To apply, visit www.christlanduniversity.edu.ng or call 0813-266-3928 and 0802-304-6920. Grab this opportunity at Christland University. Intellectual radiance.
Hello, Mrs. Martins.
Yes. Oh, Mrs. Johnson, how may I help you?
Junior's body temperature is high and he's complaining about headaches and body aches.
Not to worry. Get Bruston and suspension.
Okay, ma. I'll call you back.
Bruston and Suspension for Children is a sweet-tasting brand of ibuprofen which provides relief against toothache, pains, and fever in children after 30 minutes.
Hello, ma. Oh, Junior, stop that.
Is everything okay, Mrs. Johnson?
Yes, ma. Junior is fine now. In fact, Junior, sorry, ma. I'll call you back.
Brustin and Suspension for Children. Always take the product after meal. If symptoms persist after 2 days, consult your doctor. A quality product from Rambaxay.
2020 ń lọ sópin 2021 á dára.
Ó ga jù ọdún yìí ojú mi rí màbo ọdún tó ń bọ̀ gbọ́dọ̀ dùn.
ọmọ ọdún tó ń bọ̀ ní láti dùn ṣáá ni mo gbọ́dọ̀ mẹ́ẹ̀kì ẹ̀.
òótọ́ ni o nítorí láti oṣù kejì ọdún títí di oṣù kẹrin ọdún 2021 èèyàn mẹ́jọ ni yóò jẹ mílíọ̀nù kankan náírà tẹ́nì kọ̀ọ̀kan nínú èèyàn ọgọ́sàn 180 yóò jẹ gbẹ̀rún lọ́nà ọgọ́rùn-ún kan náírà níbikíbi lórílẹ̀‐èdè nàìjíríà lásìkò ìpolongo oríire Polaris Save and Win láti yege ṣáà ti máa fi ẹgbẹ̀rún mẹ́wàá náírà tàbí jù bẹ́ẹ̀ lọ pamọ́ sínú àkáǹtì rẹ lóṣooṣù fóṣù mẹ́ta léraléra bẹ̀rẹ̀ láti oṣù kọkànlá ọdún yìí ìyíkoto yóò bẹ̀rẹ̀ láti oṣù kejì ọdún 2021 torí náà yára tẹ *833# kàn sí wa lórí ẹ̀rọ ayélujára pẹ̀lú polarisbanklimited.com tàbí èyíkéyìí ẹ̀ka Polaris lórílẹ̀‐èdè yìí láti ṣí àkáǹtì rẹ tó o bá ṣe ń fowópamọ́ sí láyé láti jẹ̀bú ó ṣe pọ̀ sí ìpolongo oríire Polaris Save and Win yóò máa tẹ̀síwájú láti ìsinsìnyí títí doṣù kẹrin ọdún 2021 òfin àtìlànà wà o fún àlàyé sí kàn sí wa lórí ẹ̀rọ alátagbà wa lónìí.
I won't tell you the secret of better food. Na the no chicken and classic seasoning powder. The ingredient they take make am na natural by nature, like real chicken, rosemary, black and white pepper, garlic, onion, parsley, mushroom, coriander. If you knack no seasoning powder for inside your jollof, fried rice, egusi, and all other soup, you go know say flavor pass flavor. No seasoning powder. Natural by ingredients. Bangba by flavor.
YS Live.
Yes, Vishala, I was talking about Nigerians leaving this country for the Western world. Let me mention any country. And they get there, they get dehumanized. In the name of, some of them don't even have papers. They have overstayed and they could not come back to Nigeria, but they want to stay put there and enjoy that facility and all that. Whereby they get themselves enslaved. But psychologically, they are sick. Some of them, they are not fulfilled, they are not happy. What would you blame them?
Okay, thank you very much. Now, when we look at the Sustainable Development Goal 3, it talks about health and well-being. You know, the way we define that is no absence of disease alone, though. So, the well-being aspect of it is what you just touched on. Some may not have malaria, but that does not mean the person is fine. Like the example you cited, someone who is supposed to be around 50 years thereabout, looking 70 because of the mental stress and the social inequality that he has been subjected to for a long time. Now,
social inequality it should be part of this goal self.
Yes, I'm going to touch on that. Now, when we look
am I talking sense?
Correct. Yes.
Social inequality should be part of these goals.
It is.
Okay.
Goal 10. The focus.
Goal 10.
The closing the
reduce inequality. In what? Okay, any inequality. Could be social.
Any form of
yes, goal 10.
Inequality. Now, the focus of Sustainable Development Goal is on 5 things. The people. When they came together in 2015, the focus was about the people, every human being, and they said that there should be no poverty, everybody should be prosperous, every human being on planet health. Then the second thing is the planet itself, where we live, the environment. Then the third thing is prosperity, that everybody should be able to afford at least 3 square meals. You don't have to beg before you live. And importantly, there should be peace. Now, we just had issue in Ibadan recently that had disrupted the economic power of some people.
A lot of people.
Which
will have a multiplier effect.
And that is going to affect the Sustainable Development Goal 3. Then partnership, I would like to dwell on that. From what she has said,
okay,
what
the president of JCI.
Yeah, what the president of JCI has said at their level is a form of partnership they are providing. Whether the government invited them or not, they identify that need and they position themselves to meet the need. And that's the only way for us to achieve any of those goals. That partnership has to be in place. Now, in terms of health for all and well-being for people of all ages, there are about 13 targets under that goal. Yeah. And each one of them, if you don't begin to focus on them, I guess that was why you started with natality rate, mortality rate. Because you need to, what are the factors responsible for me being an endangered species being born in Nigeria? And that's one of the things that Dr. Faramadi has mentioned. You have to be able to take care of a pregnant woman so that the baby inside is well catered for. The baby is not a danger. The baby is not delivered in a place where within the first hour of birth is going to catch an infection that would kill that baby within 28 days. That is neonatal death. You want to be able to provide food, healthy food, balanced diet for that baby to grow well, for the brain to develop, so that the baby will not die of malnutrition before the age of 5. And if by chance the baby succeeds beyond 5 years, the baby is not mentally retarded, and the baby is able to function well in the community and be able to provide for himself and be independent later in life. So all of these things are things that we need to put our head together as partners. The head of state, when they came together in 2015, they identified that Millennium Development Goal of 2000 failed. And they deliberately, consciously declare in that Sustainable Development Goal that there has to be partnership. The fact that I'm in US, I'm the US president, and I have all the money, and it's lying fallow in the bank, why can't I go to Somalia where there are people who need? And that's why we see all this foreign donation and all of that. There has to be more of it, and when it is made available, it has to be judicially used. So when we do all of these things, we'll get there. But we must also realize what has happened to our world in the last 1 year, thereabout COVID pandemic, has put a break, a sort of clog in the progress towards 2030 achievement of Sustainable Development Goal. That we cannot shy away from. And that is a call for concerted efforts by all of us, that we need to rejig, we need to make sacrifices so that the little available resources, we use it judiciously. We use it judiciously. Now, on your question, the topical question you asked about why do people live and all of that, it's also a function of the mindset. Our country is not the best of country. I have a lot of my colleagues who have left the country. But I look at the streets every now and then, there are people who still need my service as more as it might be my own local community. Now, if I go to the US where they already have 1 doctor to 400 patients, and we have just 1 doctor to about 4,000 people in Nigeria, Am I doing any good? I will have done good to myself, but I'm not doing any good to this nation. If US, an average person of my caliber in the US, will sit down and say, we are enough in the US, let me come to Nigeria to come and suffer and, and benefit and give them my skill. I think we also need to take a break. This is a painful decision because when you even work and you are not getting the benefit, the financial benefit, the welfare. I have a doctor colleague here, you understand what I'm talking about. But then we still have to look.
Don't let us talk about your benefits.
So we still have to look at the world as a global village. And I'm in this village, let me make my own contribution. Why they are making theirs over there. Like someone said, the grass is greener on the side that is well watered. Why not water your own side and see if the nature or our planet is going to favor you or not?
It's 11 o'clock, let's have that, then we come back.
Mamas, on a good one, For your picking bright smile, make sure say them they brush every day with Colgate Maximum Cavity Protection because Colgate locks calcium in.
Splash FM 105.5.
YS Live.
Yes, Onome Oziegbe is the president of JCI Oluyole. Dr. Ibishola Babalola, a family physician, is University College Hospital, Ibadan. And Dr. Ibikunle Faramade is an advocate of United Nations Sustainable Development Goals, National Veterinary Research Institute, VOM. That's JOS. And I have Dr. Adishino as well, am I right?
Yes.
From
Academy Hospital.
Academy Hospital. I will still bring, maybe Dr. Adishino should, okay, I'll bring him on after this. Yes. Now, you were talking about the SDG Goal 3. Maybe I should ask Onome, how far have we gone in achieving this goal in plain language in Nigeria?
Achieving this goal, I don't know how we're going to achieve it before 2030. Because obviously, from what we've experienced so far, our experiences with the healthcare in Nigeria is not really pleasant. It's not. I don't know how we're going to achieve that. Because when you go through these things and you see these things for yourself.
Maybe you link it with the role of your NGO in achieving this goal. What has been the role you've played as JCI? So you can link it together with what the question I asked.
Okay, now in achieving this goal, over the years, providing medical facilities to these people, and then we'll feel like, okay, let's actually make it sustainable. If we want to make it sustainable, because it's about sustainability, so let's make the primary health care work for them, and then follow up with them. Since we do not have governorship or the
government support
for now. But we have partners, so let's see what we can do. So that's what we'll be doing over the years. So we partnered with hospitals, private hospitals, individuals, companies to assist in this achieving this goal 3 for these people. Now we can't do everywhere.
So what kind of partnership?
Okay, and some pharmaceutical companies, they partner, they give us drugs. They give us free drugs. They give us syringes. They give us most of the equipment we need. Then the hospitals, they bring their personnel, they bring their doctors, they bring their nurses to treat them for that whole day. So those
free
are the
of charge?
Yes, free of charge. They don't charge us for anything. They bring their ambulance in case for emergencies, and they do everything for us. We don't do anything with it. So for the renovation aspect, we partner with building companies, individuals. They give us doors. They give us roofing sheets. They give us. So that's practically how we've been doing it.
So if you put all this together, now, how do you sustain it? Who manages it? How do you ensure that all that you put together are utilized judiciously?
That's why we are here to actually partner, seek the government support. That we can only do little, we can't do everything. We need their partnership to actually make it sustainable. We need nurses that will be staying there permanently to make this
nurses that will be paid.
Yeah, they will be paid, because there is a woman that has been volunteering for the past 8 years. She's not been paid anything.
In that health center, just one. You're talking about just.
Yes, there is. I think there is a matron there.
You say
Abala Community
Health Center.
Yes. And there is another woman that has been volunteering for the past 8 years. She's not been paid anything. She volunteers to actually assist and do whatever it is.
She's a nurse, right?
I think she was trained. She has been trained to actually do the work, but she's not being paid. So actually need support. Maybe she can be staff or paid something, or maybe a doctor will go there at least once in a week to see patient, because patients don't stay in the hospital because it's not working. They don't stay there. The beds are in a bad state. Everything there is in a bad state.
Bed box, not to one bed.
If I show you the pictures, it's a gruesome sight.
I don't want to see.
It's a gruesome sight because the bed, there is nothing on the bed. Beds come in from the roof and put on the beds. I need beds practically come in and put on the bed and go away because there's nobody in the hospital. There's nothing working there. So,
so people will not want to go there at all for treatment or for anything.
Yes, because they know it's not working. So if nothing is working, the bed is full of dust and cobwebs everywhere. What will I go to the health center to go and do? It just means I want to die. That means I want to die even if I'm sick. I want to die. So I rather just stay in my house. I mean, if I die, they're fine. I died on my own, not because going to the hospital. I know that nothing is working there. So that is JCI Oluyole is a leadership organization that empowers young people like us to create positive change. So that's how we discovered that community. I decided, okay, let's do something for them that is sustainable.
ẹ já sọ Yorùbá díẹ̀ torí àwọn ìyá wa tí wọ́n ń gbọ́ wa nílé tí wọ́n gbọ́ ọ̀nà mi ò sì gbọ́ Yorùbá á di nígbà tí létí ẹ̀ ń sìn torí ẹ̀ mo ṣe fún láàyè kó sóyìnbó ẹ̀ dáadáa yes ẹ já sọ Yorùbá díẹ̀ ibi tá a bá dé yìí ṣé inú yóò máa bàjẹ́ sí gbogbo ọ̀rọ̀ tó lera wa yìí.
ṣe rí ká má wulẹ̀ dónà pẹ̀nu ohun kan tí ó bá ní lọ́kàn jẹ́ gbáà ni tó sì dẹ́rù bàyàn torí wípé tó bá jẹ́ pé
ẹ ló mú mi yàn
a wà ní ọdún 2021 a ti ń sọ̀rọ̀ nípa ọ̀rọ̀ nípa ìlera tí ò múnádóko àwọn tó wà láyé bí 40 ọdún sẹ́yìn àwọn ọmọ ń sọ pé wọ́n nírú àwọn kan báyìí lábúlé ńgbà yẹn tó sì dáa ìdí ẹ̀ nìyẹn tó fi wádìí pé ó báyìí lọ́kàn jẹ́ gan pé kí nǹkan máa dáa sí ni ṣùgbọ́n bó ṣe wà yìí ó ń bàjẹ́ sí ni ṣùgbọ́n tí mo fẹ́ kó yí àwọn èèyàn wa ni wípé tí a bá fẹ́ kí àfojúsùn ìjọba àgbáyé lórí ọ̀rọ̀ ìdàgbàsókè gbogbogbò pẹ̀lú ẹ̀ka jẹ̀ka àti àwọn àfojúsùn tá a gbé kalẹ̀ tó jẹ́ 17 tá a bá fẹ́ kó jẹ́ ìmúṣẹ gbogbo wa gbọ́dọ̀ gbà á gẹ́gẹ́ bí ojúṣe wa láti jẹ́ kó wá sí ìmúṣẹ ọ̀kan ní irú ti JCI tí wọ́n ń ṣe lọ́wọ́ yìí torí pé táwọn sọ pé ìjọba tẹ́ bá wo SDG 3 yẹn ó ní 12 to 13 targets about 13 targets now tẹ́ bá wò dáadáa ó nípa tí ìjọba lè kó ó nípa tí àwọn agbègbè ìlú ó lè kó ó nípa tí ẹnìkọ̀ọ̀kan lè kó fún àpẹẹrẹ à ń sọ̀rọ̀ nípa báwo la ṣe lè jẹ́ kí àwọn ikú aláboyún kó wálẹ̀ ọ̀kan ni pé a gbọ́dọ̀ jẹ́ kí bí ilé ìtọ́jú aláìsàn bó ṣe jìnnà síbi táwọn èèyàn ń gbé bó ṣe jìnnà sí ọ̀yẹ́ ká dínkù ìjọba ló lágbára yẹn láti dá ilé ìwòsàn alábọ́dé sílẹ̀ bó ti tọ́ àbó ti yẹ ṣùgbọ́n ìjọba nìkan lè dá sí.
ó sì wà nítòsí
àwọn ènìyàn ọ̀kan nìyẹn.
torí tó bá dòru aláboyún fẹ́ bímọ àbí kíní kan wọ́n tètè.
bẹ́ẹ̀ ni
kò ní jẹ́ pé mọ́tò òṣìṣẹ́.
bẹ́ẹ̀ tí ojúṣe ti ìlú wa wà ní pé ìlú gan torí táwọn wo pé ìjọba ń bọ̀ ìjọba irú àbànlá tí wọ́n sọ lórí Olúyọ̀lé àbànlá jẹ́ ibi tó tóbi àwọn ìpè lábà ni ó ti tóbi ń sìn àwọn ìlú àwọn àbà kéréje.
community mẹ́ta gan ni healthcare yẹn sá
tẹ́bá sọ tí tẹ́bá mẹ́nu kó n bi àbànlá ń sìn yàrá rí i pé àwọn ìlú kéréje wọ́n tún wà lábẹ́ rẹ̀ táwọn ò tiẹ̀ gbúrò kankan tí wọ́n so ó ṣeé ṣe fún àwọn tọ́lọ́run bá.
àwọn àbànlá tà ń sọ gan wọ́n ní kò sí nǹkan kan bẹ́ẹ̀ ọ̀nà yẹn ló ń ṣu sórí bẹ́ẹ̀dì pé gbogbo páànù ti já kò sí.
so àwa tí Ọlọ́run bá wò láṣìírí
jàǹkàrí wọ̀ ló wà ní gbogbo bẹ̀ kò sí oògùn kò sí.
tọ́lọ́run ṣe gé ọlà fún wípé kíní yìí kíní wa ni kì í ṣe kí ó yàtọ̀ sí kíní ìjọba tá à ń sọ ìjọba ò ní wá gba ìtọ́jú ń bẹ̀ àwa tá à ń gbé bẹ̀ lágbà ìtọ́jú ń bẹ̀ so àwa tá a jọmọ ọbẹ̀ tọ́lọ́run ti bò láṣìírí bóyá àlefọwọ́sowọ́pọ̀ bẹ́ẹ̀ táwọn jésì àfọwọ́sowọ́pọ̀ yìí pé ókè o abúlé mẹ́ta yìí o ẹ jẹ́ kí a kọ́ ilé ìgbòho alábọ́dé tàbí ilé ìtọ́jú aláìsàn alábọ́dé síbẹ̀ ká sì fi ọwọ́ tì wọ́n lẹ́yìn nípa ti oògùn ni o nípa ti omi gbẹ́ bọ́ o ni o ìlú lè gbẹ́ kànga tí wọ́n ó sì ṣe ìmọ́tótó nípa ẹ̀ láti ọ̀rọ̀ water sanitary tábà lè jẹ́ kí ọ̀rọ̀ omi gan tó já gara kó tún wọnú ẹ̀ wá a tún ti rí jẹ́ kí ọ̀rọ̀
àwọn local government kí ló ń ṣe.
ẹ̀ka àtijọba ni àwọn náà wà governance structure wa ní problem a sì ti gbà ìṣòro kan gbòógì tó lágbára ni governance story local stuff tá à ń sọ nípa ọ̀rọ̀ ilé ìwòsàn alábọ́dé kò kan government ìpínlẹ̀ kò kan federal ṣùgbọ́n ẹ mọ̀ rí i pé federal sọ pé wọ́n fẹ́ kọ́ ilé ìwòsàn alábọ́dé fún local government ẹ mọ̀ bí ra ilé rẹ̀ pé kí ni èèyàn tó wà lábùjá fẹ́ mọ̀ bí tí ó yẹ kí wọ́n kọ́ health center sí ní Olúyọ̀lé tàbí ní Akínyẹlé tàbí ní Ìdó tàbí níbì kan so ìdí ẹ̀ tó jẹ́ pé tí a bá lè fi ojú sùnùkùn wo governance structure ẹ bá ṣe ń ṣèjọba kì í ṣèjọba òṣèlú mo tún sọ ìjọba lórí ọ̀rọ̀ ètò lórí ọ̀rọ̀ ìgbáyégbádùn nípa ọ̀rọ̀ ìlera ó ní mo ń sọ yìí pé ojúṣe tó yẹ fún local government ẹ jẹ́ ká jẹ́ kí wọ́n ṣe ojú tó yẹ fún state government ẹ jẹ́ ká jẹ́ kí wọ́n ṣe ètò yẹ fún federal government ẹ jẹ́ kí wọ́n ṣe èyàn gbọ́dọ̀ tẹ́ máa fẹsẹ̀ kọ́ńsìn usage ló ń lọ torí pé kò síbi tí ó lọ ládùúgbò ẹ tí tó lè rí ìtọ́jú tó péye kẹ́ tó mọ tó ṣẹlẹ̀ kòkòrò àrùn èyí ó ti wọbẹ̀ ó ti dúpọ́ lóra rẹ̀ ó ti wọ́n lọ́jọ́ rẹ̀ ló pé irọ́ ọjọ́ rẹ̀ ò tí ì pé àwọn àlàkàn fúnra wa ní èrì jẹ nítorí ìdí èyí ẹ jẹ́ ká mọ̀ wípé ìjọba lójúṣe àwọn agbègbè ságbègbè olójúṣe àwọn agẹ́bẹ́ ẹnìkọ̀ọ̀kan alójúṣe bó landlord association gan ó ṣeé ṣe ká máa ṣe routine health check fún ara wa tíjọba bá kọ̀ wá sílẹ̀ mọ́jà kọ̀ra wá sílẹ̀ náà so that kí ni wọ́n fi ń ṣe blood pressure kí ni how long ni kí ni tó kó.
wọ́n yẹ pé landlord association owó security owó kìíní kan ìkọlà sọ́nbẹ̀ owó akólẹ̀ ìkọlà sọ́nbẹ̀.
gbogbo àwọn
kí ni ká máa sọ̀rọ̀ health wa gan community health wa gan bó o ní.
health promotion wọ́n yẹ kí akọ́ṣẹ́mọṣẹ́ nípa ètò ìlera ẹ wá bá wa sọ̀rọ̀ lórí pé irú oúnjẹ olóyè káwọn àgbàlagbà tó ti wọ 50 ọdún sókè.
ó yẹ káwọn landlord máa gbọ́ tẹ̀ sọ yìí.
so ó ṣe pàtàkì.
ẹ wá bá wa sọ̀rọ̀ lórí báwọn tó ti dàgbà oúnjẹ tó máa jẹ ní mítìn tá a fẹ́ ṣe yìí.
bẹ́ẹ̀ni a rí gbogbo ara wọn tí ó iyọ̀ yẹ kó mọ jẹ o.
nǹkan tó ṣe pàtàkì lẹ́sọ̀ láàrin.
so ẹ jẹ́ kí a fọkàn sí pé ìjọba lójúṣe agbègbè ságbègbè lójúṣe àwọn agẹ́bẹ̀ náà.
dr Bisola kí n tó pe dr Adesina wọlé ẹ̀yin náà ìwé nǹkan kan sọ̀rọ̀ lẹ̀.
ok nípa bá a ṣe máa achieve sustainable development goal 3 yẹn.
tẹ́ ẹ bá ṣiṣẹ́ lórí rédíò mi nìfín lọ́rùn lẹ̀ mo ń gbọ́ yín.
kò burú ẹ jẹ́ kí n sọ síwájú pé nítòótọ́ àti débi tá à ń lọ ṣùgbọ́n òótọ́ ibẹ̀ ni pé a ti ń gbẹ́sẹ̀ nípa iye àwọn ọmọ tó ń kú láàrin ọdún láàrin 1000 láti 2015 ní Nàìjíríà ó ti ń wá sílẹ̀ bẹ́ẹ̀ kò tí ì súnmọ́ ìwọ̀n tí àwọn tó jókòó tó gbé kinní yìí kalẹ̀ tó set ọdún mẹ́ẹ̀ẹ́dógún ni wọ́n sọ pé láàrin ọdún mẹ́ẹ̀ẹ́dógún kan tá a fẹ́ achieve lélẹ̀ àwa ti ń achieve ẹ̀ díẹ̀díẹ̀ bóyá kí 11 people kú ní kí 12 people kú ní last year láàrin àwọn kékeré ọdún yìí ó ti di 11 people kò tí ì tó nǹkan tá a fẹ́ bóyá a fẹ́ bí 5 out of 1000 but 12 ló kú last year 11 ló kú lọ́dún yìí a ti ń gbẹ́sẹ̀ yẹn díẹ̀díẹ̀ bẹ́ẹ̀ àìtí ìdèmí.
Ọlọ́run á jẹ́ ká débi tí wọ́n tẹ̀ tí ní kú mọ́ rárá.
àmì so eléyìí tá a bá ní òye pé a ti ń gbìyànjú èèyàn náà tún fún wa ní ìwúrí láti ṣe sí àti gẹ́gẹ́ bí Dr. Faramade ti sọ lẹ́ẹ̀kan yẹn ó ṣe pàtàkì kí a ní òye pé nǹkan yìí nǹkan gbogbo wa ni èmi believe pé kò make any sense rárá àtọ̀ kéèyàn kan ní 10 billion naira nínú àkáǹtì ẹ̀ kéèyàn kan dẹ̀ wà ní street ẹ̀ tí ò ní 1 naira tó máa fi jẹun kéèyàn kan máa wa mọ́tò ó ga gẹ̀gẹ̀rà bẹ́ẹ̀ ọ̀nà títí ò da lára sustainable development goal tá à ń sọ yẹn àwọn àrùn chronic àrùn tàbí hypertension ẹ̀yìn ríro ìtọ̀ ṣúgà wọ́n wà ń bẹ̀ èèyàn tó ń gun ọ̀kadà lórí ọ̀nà tí ò da olóyún ni ó pọn mọ́ sẹ́yìn ó wà lórí ọ̀kadà oyún lè wálẹ̀ láti bẹ̀. èèyàn tó ń gba ọ̀nà yẹn lójoojúmọ́ fọ́dún 5 fọ́dún 10 tó jẹ́ pé bẹ́ẹ̀ ló ń gbà lọ síbi iṣẹ́ ajá sí gárígátá dá lónìí ajá sí lọ́la díẹ̀díẹ̀ èèyàn á máa dùn ìgbà tó bá máa pé 50 years tó jẹ́ pé bàbá ẹ̀ ó pé 80 years kó tó máa lo ọ̀pá òun ti bẹ̀rẹ̀ sí ní lo ọ̀pá láti fi.
ara ohun tó fà á nìyẹn.
morbidity tá à ń sọ nìyẹn.
morbidity tá à ń sọ nìyẹn.
ìgbéyàn bẹ́ẹ̀ bá tó bá lè lọ síbi iṣẹ́ mọ́ torí ẹ̀yìn dídùn tó ń pa ibi iṣẹ́ jẹ wọ́n á ní kó kúrò níbi iṣẹ́.
poverty dé.
poverty bẹ̀rẹ̀ so gbogbo àwọn nǹkan báyìí ló yẹ ká rò.
dẹ́dẹ̀ dé àìsàn ti wọ̀ lára.
Gates àti ìyàwó ẹ̀ wọ́n á send owó sí Nàìjíríà kó fi máa ṣe research lórí adẹ̀ láwọn billionaires ní Nàìjíríà yìí náà wọ́n kàn fi ń kó mọ́tò jọ ni so a ní láti.
wọ́n á tún máa show ẹ̀ lórí social media.
a ní láti inequality yẹn we can remove it. káwọn olówó wa conscious láti di philanthropist à immortalize wọn àwọn èèyàn á rántí wọn fún rere bẹ́ẹ̀ kí wọ́n lo owó wọn ò ní kówó yẹn lọ sọ́run kí wọ́n lo owó yẹn kí wọ́n fi tún ìlú ṣe.
ẹ jẹ́ kí Dr. Bisola ẹ jẹ́ kí Dr. Adesina náà wọlé sí ibi tẹ́ ẹ jókòó sí yẹn kó lè yìí sì fún wọn láti jókòó mo ṣe ní kíbi ẹ jókòó sí ni kan jókòó sí Mr. Dr. Adesina ẹ ǹlẹ́ ẹ mọ̀ káàárọ̀ tí ń gbọ́ ogun tá a ti sọ látàárọ̀.
bẹ́ẹ̀ni sá.
ẹni àfikún àbí ìyọkúrò.
ok àwọn ọ̀gá mi tó wà níbi tí wọ́n ti parí iṣẹ́ wọ́n ti sọ gbogbo ẹ̀ but in addition bí wọ́n ṣe sọ partnership is the way to go. Government cannot handle everything. Owó ìjọba ọ̀ka. Owó
àbọ̀wọ́.
Owó
ìjọba lówó ẹ mọ̀ sọ yẹn ìjọba lówó ibi tó ń gbowó sí ló pọ̀ jù ibi tó ń gbowó lọ ló pọ̀ ìjọba lówó lọ́wọ́.
Nàìjíríà
wọn lọ́nà jẹ́ lawó tó
àwọn tó yẹ tí ní kọ́ ṣiṣẹ́ náà àwọn náà tún wọ́n sáré ìtàkùn wọn àìmọye à ń gbọ́ yín.
If we are talking about healthcare industry it's a very expensive industry. Budget tí ó yẹ kó lọ sí ministry sí health is far below what is recommended. We should be talking about 15% of the total budget. We are doing less than 5% in the last 10-15 years. I think the highest tí àti gbà ní health is 6%. That is national budget. So there is no way partnership will not come in. Even in all those countries tí a máa ń wò lókè àwọn tí wọ́n bájọba fọwọ́sowọ́pọ̀ láti mú ètò ìlera kó kan gbára lù ó pọ̀ bí Pfizer ṣe ń donate ní GSK máa donate gbá làwọn yẹn máa donate àwò so in tó bí mission JCI tí wọ́n fẹ́ ṣe ní àbáńlá náà nìyẹn ká fọwọ́sowọ́pọ̀ even tí gbogbo ẹ̀ bá pé àwọn aráàlú need the support láti jẹ́ kí nǹkan kárí. Gọ́ọ̀mẹ̀ntì ò lè káàtì ẹ̀ ní gbogbo health center wà. We have more than 720 health centers in Oyo State, for example.
How many are functioning?
To be honest, majority are not optimal. They are not functioning optimally. Iṣẹ́ wọn ó yẹ kí at least nurse kó wà ní health center àwọn kan wà tá à ń pè ní chief community health extension worker ó yẹ kó wà ní health center kọ̀ọ̀kan health assistant ó yẹ kó wà ní health center kọ̀ọ̀kan èyí tó wà jẹjẹ comprehensive health center ó yẹ kí dókítà wà ń bẹ̀ àwọn health center tí wọ́n ní gbogbo ń tà ń sọ pé kò wọ́pọ̀
nínú 720
nínú 720 àwọn tó wà ní kí nọ́ọ̀sì kan kó máa sáàbù patient 200 lójúmọ́ ẹ̀yin ó ṣiṣẹ́ pa yẹn.
ẹ já polówó ọjà ká padà wá.
1960 bets don return with big FCO as they don arrange new management wey don come back better and stronger. Dem dey pay commission to their agents' bank accounts and winnings to their customers sharparly. No delay. You fit do football to virtual games plus live bet jackpot for inside 1960 bet. Visit their website on top www.1960bet.com. 1960 bet, play and win.
Bàbá pẹ̀lú àtẹ̀bí rẹ̀ rí lọ́sẹ̀ tó kọjá. Bàbá pẹ̀lú àtẹ̀bí rẹ̀ rí lọ́sẹ̀ yìí. Ṣùgbọ́n kí ló wá jẹ́ kí nǹkan ó yàtọ̀ fún wọn o? Ẹsẹ̀ rí bàbá pẹ̀lú gbọ́ pé GoTV máa ṣe dín owó wọn kù láti $4,400 sí $3,000 kan ní báyìí. Pẹ̀lú ọ̀pọ̀ eré ìdárayá, eré oníṣe ilẹ̀ wa, tẹlinùfẹ́là àti erémọdé. Inú bàbá pẹ̀lú àtẹ̀bí rẹ̀ kan dùn ní ṣáá. Nítorí náà, ìwọ náà dàbí bàbá pẹ̀lú. Jẹ́ kí ọpọ́n rẹ̀ sún sí GoTV Max fún $17,000 kí o bẹ̀rẹ̀ sí ní jẹ̀gbádùn eré ìdárayá lẹ́rẹ̀bẹ̀ntẹ́ lẹ́dínwó máa gọra ẹ nítorí ìwọ̀nba àsìkò láǹfààní rẹ̀ á fi wá o. Ìlànà àti àdéhùn àṣà o. GoTV nífẹ̀ẹ́ rẹ̀.
Akẹ́kọ̀ọ́ mi ọ̀wọ́n ètò àti kẹ́kọ̀ọ́ pẹ̀lú ìgbáradì fún ìdánwò ní ìtẹ̀lẹ́lẹ́sẹsẹ ní ibùgbé rẹ̀ ti wà báyìí o. Ìlàkàkà àti yege nínú ìdánwò ti dópin bí o bá lè darapọ̀ mọ́ ètò àtúnṣe ẹ̀kọ́ tó yè koro lórí rédíò tó ń ran akẹ́kọ̀ọ́ lọ́wọ́ láti tayọ nínú ìdánwò bí àwọn olùkọ́ tó mòye ṣe ń yanjú àwọn ìbéèrè ìdánwò tó ti kọjá. NECO ni o tàbí WAEC, Junior WAEC àti Common Entrance. Ẹ̀wẹ̀ darapọ̀ mọ́ ọ̀dọ́mọbìnrin Victory Yinka Banjo akẹ́kọ̀ọ́ tó ṣe ìyege ńlá nínú WAEC SSE rẹ̀ ní ọdún 2020. Ó là wọ́n lọ nígbà tí ó gba 335 nínú 400 nínú JAMB UTME. Ẹ láǹfààní láti gbọ́ ìjìnlẹ̀ àṣírí àṣeyọrí Victory àti pẹ̀lú ìyanjú ìbéèrè ìdánwò tó ti kọjá fún ìwà akẹ́kọ̀ọ́. ètò yìí máa ní ipa ńlá ìgbà bẹ́ẹ̀. Tí o bá jẹ́ òbí tí o sì ń gbọ́ wa, jọ̀wọ́ sọ fún ọmọ rẹ kó darapọ̀ mọ́ wa lórí Splash FM látọjọ́ Monday di Wednesday látagogo 5 sí 5 àbọ̀ ìrọ̀lẹ́, Thursday di Friday látagogo 4 àbọ̀ sí 5 ìrọ̀lẹ́, Saturday látagogo 3 sí 4 àbọ̀ ìrọ̀lẹ́ àti 4 àbọ̀ sí 5 ìrọ̀lẹ́. Ẹ jẹ́ ká jọ jùmọ̀ borí 2021.
Learn at Home is brought to you by Data Science Nigeria, partnering with the MasterCard Foundation.
YS Live.
YS Live.
Ọlọ́run bá mi ò ní jó bàjẹ́ wa náà ti mọ̀ pé Abolu ó jẹ́ gómìnà wa lógún gan àti gbogbo aráàlú. Ìdí nìyẹn tí gómìnà láti Niger State, Zamfara, Kano àti Kebbi tí wọ́n fi yọjú sí ìpínlẹ̀ Ọ̀yọ́ pẹ̀lú gómìnà nípínlẹ̀ Ọ̀yọ́ ẹnjìnà Ṣèyí Mákindé tí wọ́n wà ní ṣáṣá báyìí pé kí gbogbo ètò kó lè tò kí àlàáfíà lè jọba. David Bello ikọ̀ wa ní Splash FM ó wà ní ṣáṣá báyìí níbi tí ìpàdé ńlá ti ń lọ tí àwọn gómìnà wà ń bẹ̀ tí baálẹ̀ ṣe sọ̀rọ̀ tán ni baálẹ̀ ṣáṣá ṣe sọ̀rọ̀ tán ni. David Bello bó o ní o. Báwo ni gbogbo kí ló ń lọ lọ́hùn àti pé kí ni baálẹ̀ sọ kí làwọn nǹkan tí ó yẹ kí ti aráàlú gbọ́ báyìí ká lè.
baálẹ̀ ṣe sọ̀rọ̀ tán ni o wọ́n sì ní bó ṣe ń lọ báyìí pé kò sí wàhálà kankan ní ṣáṣámọ́ pé gbogbo ẹ̀ ti wálẹ̀ dáadáa ṣùgbọ́n kí gómìnà àti gbogbo gómìnà tó ń wá wọ́n sì bá wọn dá sí dáadáa kí wàhálà ọjà leadership ọjà pẹ̀lú àyàn ọ̀gá kan fún ọjà kó má fa wàhálà mọ́ pé báwọn ṣe wá àwọn tí ń gbé papọ̀ pẹ̀lú Haúsá pẹ̀lú other ethnic group látọjọ́ ẹ̀ pé kò sí wàhálà náà pé àwọn kan lọ́kàn fa gbogbo wàhálà láàrin wọn.
Ọ̀dà bẹ́ẹ̀ kálàáfíà lè jọba náà ní gbogbo kókó ohun tá à ń sọ yìí pé àlàáfíà kó lè túbọ̀ gbilẹ̀ dáadáa. ẹsẹ̀ security gómìnà wa Fatai Owóṣe ní ṣé wọ́n wà ń bẹ̀?
àwọn náà wà ń bí.
ẹ jẹ́ kí n bá wọn sọ̀rọ̀.
Hello studio.
ẹ káàárọ̀ o.
Hello.
ẹ káàárọ̀ sà.
ẹ káàárọ̀ o.
Yemi Sonde lẹ́ ń bá sọ̀rọ̀ láti Splash FM YS Live. ṣé bàbá Fatai Owóṣe ní nìyẹn ṣe security? Bẹ́ẹ̀ ni a ní ká mọ̀ látọ̀dọ̀ yín ká mọ̀ ohun tó ń ṣẹlẹ̀ lọ́wọ́ lọ́hùn-ún àti ìpàdé tí ó ṣẹlẹ̀ lọ́wọ́lọ́wọ́ yìí àti ohun tó yẹ káràlú gbọ́ nípa ẹ̀.
bí ẹ ti ṣe máa gbọ́ gómìnà ìpínlẹ̀ Ọ̀yọ́ àti àwọn gómìnà tó wá látòkè Ọya, Zamfara, Kano, Kebbi àti Niger State ni wọ́n tẹ̀lé gómìnà ìpínlẹ̀ Ọ̀yọ́ wa gómìnà Ṣèyí Mákindé wá sí ṣáṣá láti wá wo gbogbo ìṣẹ̀lẹ̀ tó ṣẹlẹ̀. Wọ́n ti lọ sí àárín ọjà, wọ́n ti wo bí extent nǹkan tó bàjẹ́ ti ṣe rí, wọ́n dẹ̀ ti lọ sí ọ̀dọ̀ bàbá sẹ́ríkì ṣáṣá, wọ́n wà lọ́dọ̀ bàbá baálẹ̀ ṣáṣá ń sẹ́yìn. Nǹkan tí àwọn gómìnà wa dẹ̀ ń sọ ni wípé àti Haúsá àti Yorùbá wọ́n ti jọ ń gbé papọ̀ tẹ́lẹ̀. Àwọn bàbá kábíyèsí méjèèjì, bàbá ṣáṣá sẹ́ríkì ṣáṣá, bàbá baálẹ̀ tiwa ní ṣáṣá náà, gbogbo wọn ló sọ pé àwọn kan ló fẹ́ bàlújẹ́ wípé àwọn ọmọ ìlú ṣáṣá wọ́n ti gba Haúsá mọ́dọ̀ tipẹ́tipẹ́ kó wá tó di pé àwọn tó jẹ́ pé wọ́n fẹ́ bàlújẹ́ yìí wọ́n wá dá wàhálà sílẹ̀ di ṣáṣá. Àwọn tó dẹ̀ ń gbé ṣáṣá oníkálukú wọn ló fẹ́ kí ìrẹ́pọ̀ wà kí wọ́n lè máa bá okòwò wọn lọ torí bá a ti ṣe ń sọ̀rọ̀ yìí ọ̀pọ̀lọpọ̀ ni onílé tó lè wọ̀, ọ̀pọ̀lọpọ̀ ló jẹ́ pé gbogbo nǹkan ọrọ̀ ajé wọn ti bàjẹ́. Ìyẹn tiẹ̀ wá kéré, ọ̀pọ̀lọpọ̀ ni wọ́n ti fẹ̀mí ṣòfò, ẹ̀mí ò dẹ̀ ṣe é replace. so gbogbo nǹkan tí àwọn gómìnà ń sọ ni wípé á láti fi eléyìí sẹ́yìn wíwá tí wọ́n dẹ̀ wáyé ó tún jẹ́ nǹkan tó yàtọ̀ ní nàìjíríà tẹ́lẹ̀ torí tó bá ṣe tẹ́lẹ̀ ni a ti gbọ́ pé àwọn ará kánò ti máa ní kí àwọn ọmọ ìbàdàn kọ́ máa padà bọ̀ tó kálukú á ti máa kẹ́rù káàkiri òun ló fi jẹ́ pé wíwá táwọn gómìnà tí wọ́n wá látòkè ọ̀yá wá yìí ó jẹ́ nǹkan tuntun ní nàìjíríà wọ́n dẹ̀ ti fi tolóṣèlú náà sí ẹ̀gbẹ́ kan torí ẹ rí i pé lára àwọn gómìnà tó wá àwọn kan pdp àwọn kan apc tó bá ti jẹ mọ́ nǹkan ètò ààbò àti àlàáfíà àwọn aráàlú.
gbogbo aráàlú ló kàn. wọn ò fi ń ṣètò olóṣèlú.
a rò wípé gbogbo akitiyan tí wọ́n ń gbé yìí tí àwọn èèyàn wa kò sí ẹni tó máa ṣòfò ẹ̀mí àbí tó máa pàdánù nǹkan tó fi ń jẹun tí ò ní ta lára ṣùgbọ́n tí a bá fi lè jẹ́ kí ìrẹ́pọ̀ wà báyìí wọ́n á lè tètè bẹ̀rẹ̀ àti tún nǹkan ṣe ẹ̀mí ò ṣe é rà padà ṣùgbọ́n bó tiẹ̀ ṣe páwọn ẹbí wọn wọ́n á lè ṣe nǹkan fún wọn wọ́n á dẹ̀ wá lè jókòó wípé gbogbo àwọn nǹkan tí ilé bàjẹ́ ni nǹkan òwò wọn bàjẹ́ ni láti lè tètè kíákíá ràn wọ́n lọ́wọ́ ṣùgbọ́n torí ìlú le bá a ti ṣe wáyé so bí wọ́n ti lè ṣe kíákíá láti ran gbogbo àwọn èèyàn wa lọ́wọ́ ni ọ̀pọ̀lọpọ̀ wà tí ò síbi tó máa sùn ọ̀pọ̀lọpọ̀ wà tó jẹ́ pé àti jẹun àárọ̀ ọ̀sán ó le fún tẹ̀ so a rò pé lẹ́yìn eléyìí táwọn èèyàn wa bá ti fara balẹ̀ wọ́n á lè fún àwọn ìjọba wa láàyè láti pèsè fún gbogbo nǹkan ṣe.
torí tí gbogbo nǹkan ṣe yẹn náà ni kókó bẹ̀ àtẹ̀wò pé ìgbà wo ló ṣeé ṣe kí wọ́n lift curfew yẹn àti pé méjì ni ìbéèrè yẹn o àti pé ẹ ti rí àwọn tàwùsá àtàwọn yorùbá àbí bẹ́ẹ̀ kọ́ sà ṣé ń gbọ́ mi. mo ní ẹ ti rí àwọn haúsá àti àwọn yorùbá sà.
àwọn méjèèjì ni wọ́n ti rí.
ṣé wọ́n ti jọ ní wọ́n ti ládéhùn báyìí pé kò sí wàhálà mọ́ ǹjẹ́ wọ́n ti jọ ládéhùn pé kò sí wàhálà mọ́ àti pé gbà wo ni ká máa rò pé wọ́n lift curfew yẹn tí gbogbo nǹkan fi lọ padà ní sẹ́rẹ́rẹ́ wẹ̀rẹ̀rẹ̀.
látàná ni wọ́n ti ń gbé ìgbésẹ̀ bàbá ní kàn ṣe curfew káwọn èèyàn má jáde tí a mọ̀ pé nílùú wa ń bí báyìí àtọwọ́dẹ́nu là ń ṣe ẹni tó ń dín àkàrà ẹni tó ń dín pọpọ́f ọjà tó bá tà lálẹ́ ló máa fi bọ́ ọmọ ẹ̀ láàárọ̀ bó ṣe jẹ́ pé wọ́n á lè tètè lift curfew yẹn ó ní gbogbo agbára tí wọ́n ń ṣe lọ́wọ́lọ́wọ́ tó tẹ̀ tó jẹ́ kó di lónìí ni wọ́n ti pe àwọn méjèèjì jọ wípé ebi ò gbọ́dọ̀ pa àwọn èèyàn wa jù báyìí lọ pé àdẹ gbọ́dọ̀ tún pàdánù ẹ̀mí ju eléyìí lọ so ìgbésẹ̀ yẹn a rò pé tí ìpàdé táwọn gómìnà yìí tí wọ́n wá ṣe lénìí tó bá ti lọ tán a tún lè bára wa sọ̀rọ̀ sí tó fi jẹ́ pé oníkálùkù a lè padà sí ibi òwò ẹ̀ àwọn tí wọ́n dẹ̀ pàdánù èèyàn wọn náà kí wípé àwọn náà lè tètè mọ bí wọ́n á tún ṣe bẹ̀rẹ̀ padà torí ọ̀pọ̀lọpọ̀ wà tó jẹ́ pé ó ti dókó sìn ọ̀pọ̀lọpọ̀ ọmọ ló ti di aláìní bàbá àbí aláìní ìyá gbogbo ìyẹn ni nǹkan tí wọ́n fẹ́ tètè gbé kalẹ̀.
ẹ ṣé gan ni.
jẹ́ wípé nǹkan ò ní bàjẹ́ jù báyìí lọ.
ẹ ṣé gan ọ̀gbẹ́ni fatai ó ṣe é ní ss security sí gómìnà wa ẹ ṣé púpọ̀ yóò máa dáa kò ní bàjẹ́ ìpínlẹ̀ ọ̀yọ́ ò ní dàrú ó ṣe o david bello ẹ kú iṣẹ́ lọ́hùn-ún.
I won't tell you the secret of better food. Na the no chicken and classic seasoning powder. The ingredient they take make am na natural by nature, like real chicken, rosemary, black and white pepper, garlic onion, parsley, mushroom, coriander. If you knack no seasoning powder for inside your jollof, fried rice, egusi and all other soup, you go know say flavor pass flavor. No seasoning powder. Natural by ingredients. Bangba by flavor.
OneXBet huge wins from high odds all the way with the fastest payout. Take more of our winning advantages from your deserving bets on all sports. Because with OneXBet, everyone can win. What about you? Visit our website on onexbet.ng. Use promo code BETNG and get up to 200% bonus on your first deposit. Yes, 200% bonus on your first deposit. OneXBet. Bet for every taste.
Uncle Dentist, wetin be cavities and how Colgate take dey protect my teeth from cavities? Shey dey use comfort?
No dear, na hole for teeth dey cause most tooth pain wey be cavity. But if you use Colgate Maximum Cavity Protection take brush every day, the confirmed formula go help keep natural calcium inside our teeth wey go protect them from tooth decay.
Time don reach to upgrade to the world's most chosen toothpaste, Colgate, because Colgate locks calcium in.
And the Nigerian Dental Association, they recommend Colgate.
Lights, camera, lake on.
No, it's not an act. This is my life for all to see. In the bright lights, see blessings how they follow me. From small beginnings to big brother. From the chances I take to the inspiration I give others. I am a rapper, a singer, a winner. I am an icon. So when they turn the lights on, they see that I am Lakon.
Watch I Am Lakon, a brand new Showmax original reality series, only on Showmax.com.
Hey, darling, have you ported your phone number?
Yeah, I did it yesterday, and I have been enjoying the new one. Actually, I regret I didn't do it way earlier.
Well, there is a new port in town.
What is that? Wait, can I port my car to a Rolls Royce?
Wifey, no, you can't port your car, but you can switch your pension fund administrator, PFA, to ICO Pension. This is made possible because the National Pension Commission has launched the RSA transfer system, which means you can also now enjoy the quality service I am accustomed to at ICO Pension. You have to do it immediately to avoid another regret.
Nice! This is the best news ever!
Yes, dear. To port to ICO Pension today, visit www.icopension.com/switch or call 0700 ICO PFA. And in no time, you will also enjoy their excellent customer service.
Yes, so Rose and ICO forever.
You see?
Someone is jealous. Okay, Rose and Larry together forever.
ICO Pension. Tomorrow's peace of mind starts with today's plans. Some energy drinks promise power, but are more like this. What you need is this. New Predator Energy Drink. Rule your kingdom. Now sells for only 200 naira.
Iná mọ̀nàmọ́ná a máa fúnni ní ìmọ́lẹ̀ a sì máa mú ìdẹ̀rùn wá láti wá dènà ìjàmbá iná mọ̀nàmọ́ná. Ojúlówó wáyà tàbí kébù ló yẹ ká fi fa iná nínú ilé, lọ́fíìsì àti nínú ìlú. Pure wires and cables ní àwọn ilé-iṣẹ́ mọ̀nàmọ́ná àti àwọn agbaṣẹ́ṣe yàn láàyò. Ojúlówó ni, kì í bó lára, kò kì í jóná àbáàdì, kì í kán sínú, ó sì fini lọ́kàn balẹ̀. Ìdí nìyí tí Standard Organization of Nigeria fi fòǹtẹ̀tẹ̀ tí Nigeria Electrical Contractors náà fi dìbò fún. Bí copper cable ṣe wà ní aluminium cable ń bẹ nípele lówó tí kò gún pa. Pure wires and cables tó jẹ́ ọ̀kan lára àwọn ọmọ ẹgbẹ́ Kaman ló ṣe ojúlówó wires and cable jáde. Olú iléeṣẹ́ Pure Wires and Cables Limited wà ní Afrin's Compound, Fort Gate, number 122/132, Oṣòdì Apapa Expressway, Ìyànà Ìsọlọ̀ bus stop, Lagos. Ẹ̀rọ ìbánisọ̀rọ̀ wọn ní 080-803-03257. Pure Wires and Cables. Ìrọ̀rùn fi iná mọ̀nàmọ́ná.
You haven't touched your food since I saved it.
Darling, I'm very worried and I'm tired of spending huge amount of money repeatedly on electronic appliances that keep breaking down. It's frustrating.
Daddy, the washing machine has stopped working.
Oh, not again.
Solar Telecoms and Electronics Store, the Jagaban of phones and electronics, is the one sure place to get quality electronic appliances at the lowest price. In fact, Solat is currently offering you 20% discount on flat screen TVs, deep freezers, air conditioners, washing machines, gas cookers, and other appliances. Visit Solat Electronics showroom today at J. Allen Dugbe, Solat Mega Store, Mokola Isolat Building, Mokola Palms Mall, and Challenge for all brands of electronic appliances and phones. Remember, Solat Electronics is offering 20% discount on all purchases. For inquiries, call 0701-684-1630. Solat Telecoms. You deserve the best.
Oh, lunch. Guys, I'm going for lunch. Please, put more stew. Nice meal. My chest.
Suffering from heartburn and indigestion? Try Just Eat. My recommendation for the past 26 years. Just Eat is a brand of aluminium and magnesium hydroxide and simethicone. Just Eat is available in suspension and tablets. Remedy for heartburn, indigestion, flatulence, and acidity.
Just Eat. Now available in new packs. If symptoms persist after 3 days, please see your doctor. Read leaflet inside.
2020 ń lọ sópin. 2021 á dára.
Ó ga jù ọdún yìí ojú mi rí màbo ọdún tó ń bọ̀ gbọ́dọ̀ dùn.
ọmọ ọdún tó ń bọ̀ ní láti dùn ṣáá ni mo gbọ́dọ̀ mẹ́ẹ̀kì ẹ̀.
Òótọ́ ni o nítorí láti oṣù kejì ọdún títí di oṣù kẹrin ọdún 2021 èèyàn mẹ́jọ ni yóò jẹ mílíọ̀nù kankan náírà tẹ́nì kọ̀ọ̀kan nínú èèyàn 180 yóò jẹ ẹgbẹ̀rún lọ́nà ọgọ́rùn-ún kan náírà níbikíbi lórílẹ̀‐èdè Nàìjíríà lásìkò ìpolongo oríire Polaris Save and Win láti yege ṣáà ti máa fi ẹgbẹ̀rún mẹ́wàá náírà tàbí jù bẹ́ẹ̀ lọ pamọ́ sínú àkáǹtì rẹ lóṣooṣù fóṣù mẹ́ta léraléra bẹ̀rẹ̀ láti oṣù kọkànlá ọdún yìí ìyíkoto yóò bẹ̀rẹ̀ láti oṣù kejì ọdún 2021 torí náà yára tẹ *833# kàn sí wa lórí ẹ̀rọ ayélujára pẹ̀lú polarisbanklimited.com tàbí èyíkéyìí ẹ̀ka Polaris lórílẹ̀‐èdè yìí láti ṣí àkáǹtì rẹ tó o bá ṣe ń fowó pamọ́ sí láyé láti jẹ̀bú ó ṣe pọ̀ sí ìpolongo oríire Polaris Save and Win yóò máa tẹ̀síwájú láti ìsinsìnyí títí doṣù kẹrin ọdún 2021 òfin àti ìlànà wà o fún àlàyé sí kàn sí wa lórí ẹ̀rọ alátagbà wa lónìí.
Brace up for the future. Study nursing, doctor of physiotherapy, medical laboratory science, accounting with ICANN professional certification, mass communication, criminology and security studies, software engineering, cybersecurity, biotechnology, and other relevant courses at Crestland University, Abeokuta, the university arm of Crestland Schools. Crestland University is a world-class university with state-of-the-art laboratories, libraries, studio, entrepreneurship certification, and good accommodation within a conducive environment for learning. At Crestland University, transfer to 200 and 300 levels are available at affordable rates. Top-up conversion programs are also available. Our upcoming program is law. Our fees are affordable with flexible payment plan. To apply, visit www.crestlanduniversity.edu.ng or call 0813-266-3928 and 0802-304-6920. Grab this opportunity at Crestland University. Intellectual radiance.
YS Live.
Yes, Dr. Adesina, kó tó di pé àwọn èèyàn pè wá torí àwọn èèyàn máa pè wá sí ohun tá a ti ń bá bọ̀ yìí. Nọ́mbà tí wọ́n sì pè wá sí 08091551055 08091551055 0056998678070 69493000 nọ́mbà tó máa pè wá sí nìyẹn. Yes, ẹ̀ ń bá ọ̀rọ̀ kan lọ kó tó di pé a lọ lẹ́ẹ̀kan. Mo fẹ́ kẹ́ ẹ fulẹ̀ lórí ẹ̀ káwọn èèyàn wá pè wọlé.
Ok, nípa partnership in healthcare. Bí wọ́n ṣe sọ síwájú, partnership nìkan ló lè ṣe. Apá ìjọba ò lè ka. Kò síbi tí ìjọba nìkan ti máa ń dágbé gbogbo nǹkan everywhere in the world. Àwọn NGO wọ́n nípa tí wọ́n ń kó. Community associations wọ́n nípa tí wọ́n ń kó. Bí bá ṣe sọ síwájú, àwọn landlord association tó bá jẹ́ ìdánilẹ́kọ̀ọ́ àbí ìmọ̀ràn fún àwọn tó ń gbàdúgbò pé kọ́tà wa ẹ jẹ́ ká máa kó gbogbo ìgbà igbó tí ó ṣe rẹ́sì.
irú àwọn ọdẹ ìlú Ìbàdàn tó tẹ̀ ń ṣètò láńlọ́ọ̀dù lọ́jọ́ Jímọ̀ yìí ó yẹ kán gbérú àwọn dókítà máa wá sínú inú pàdé wọn káwọn àzùn pé wọ́n wà ní landlord association lóòótọ́ kí dókítà wá dá wọn lẹ́kọ̀ọ́ káwọn landlord lè kẹ́kọ̀ọ́ ńbẹ̀ gbogbo landlord àwọn dókítà bá lè lọ bá gbogbo landlord wọ́n lè gbọ́ lórí rédíò kó sì ṣe wọ́n láǹfààní mo ti challenge ọdẹ báwọn mò ń gbọ́ yín.
bẹ́ẹ̀ni so ibi tí ó lè ṣe tí gbogbo ẹ fi lè kárí nìyẹn tàbá yẹn ká máa dúró de ti government experience sọ fún wa pé ẹni tó bá fẹ́ wò ṣẹ́jú àkànní yóò pẹ̀lẹ́ tí omi.
Modupe Praise. Thank you. Modupe Praise on our social media page says the JC is doing a good job. The government cannot do it all alone. I also think it's better to call attention to what the government is working on. They are doing the health center upgrade gradually, up JC for partnership. Okay, the president is saying you are doing a good job. JC Oluyole, for the efforts you... Okay, let's have the call. Okay, good morning. Ekaro.
Ekaro, alàgbà Yemi Sonde.
Sir.
Ẹ kú iṣẹ́ ọpọlọ.
Ọlọ́run ni o.
Oníwàásù tó yà kàlí ló sọ̀rọ̀.
Eba.
Ṣé rí nǹkan kan yà mí lẹ́nu nílùú Nàìjíríà yìí? Ṣé àwọn Yorùbá ní kéríkì Yorùbá ṣé lọ́ba Yorùbá ní...
Èyí tá a bà mú wá ní ká máa fẹ́ kẹ́ ẹ dá sí ọ̀rọ̀ tí ìlera tá à ń sọ yìí ni a máa fẹ́ ká fókọ̀sì lé báyìí. Àfihàn làbàrà ni.
Oyè mi nígbà tẹ́ gbé ẹ̀yìn náà lẹ́gbẹ́ wa.
Bẹ́ẹ̀ ni àfihàn ṣàlàfíbọ̀ ni.
Àṣùgbọ́n ó yẹ kẹ́ yìí náà ń tọrọ fún yín bàbá.
n ta fèsì látàárọ̀ ni mo fẹ́ ká lọ ni àwọn ètò mi à lọ sápá abẹ yẹn.
ọ̀dà àmọ̀dá sí ní sábà tó gbọ́.
ká má dà lóru mọ́ṣàpá. eléyìí yes Jesse, what more do you think should be done? NGO, that's what JCI is, am I right?
Yes, sir.
He was talking about landlord association, he was talking about community support, he was talking about partnership. What more do you think can be done?
Okay, I think more partnership. Like in terms of the community, they have actually been partnering with us. They cooperate, they come out whenever we come for this project. They appreciate our efforts. But we need more partners. I also want to say thank you to all our partners that have been partnering with us. LAD Medical, academic hospitals, Fullmark Pharmacy, Sterling Pharmaceutical Companies, Chester Farms, Suko Building.
All these you are mentioning, you're going to pay. You are going to pay. This is commercial. Because mentioning their name.
So it is not easy for them to give us their staff every time and give us these resources to do this thing. It's free. We are not paying them anything to do it.
Did I collect money from you?
What do you want to say? Yes,
no, I'm asking you. Did I collect money from you?
Yes, media, I didn't collect money from us. So what do you want to say? Thank you.
Splash FM, you should say thank you to Splash FM.
Splash FM, thank you for the support. We need more partners. If it's something that can be sustainable, we need more partners. Because there are so many other health centers all over Oyo State that is facing some problem like this too. So when there are partners, we can actually do more. We can't wait for the government, but we want government to also come in and also assist, because all these health centers, I think they have allocations, but they are not using it to work. So we need it to work. We actually need more partners to make this thing work. We can't do everything alone.
All right, now let's pick one or two more calls. Aláboyún bí wọ́n ṣe máa lè gbé oyún wọn tí kò ní bàjẹ́, Ọlọ́run bá sì ní jó bàjẹ́. Àwọn ìgbésẹ̀ olóyè kan gbé, àwọn oúnjẹ olóyè kan jẹ, tọ́n bá bímọ tán, àwọn ìtọ́jú olóyè kan fúnrú ọmọ bẹ́ẹ̀. Tí ọmọ yẹn tí ó fi yè dáadáa, Ọlọ́run bá mi ò ní jó bàjẹ́ àní bímọ àbíkú, Ọlọ́run ó sì bá wò wọ́n. Bẹ́ẹ̀ àti bẹ́ẹ̀ lọ. Àtàwọn nǹkan míì tí a fura sí, ẹ̀wòrí ìtàn sọ lẹ́ẹ̀kan, ẹni tó wà lórí ọ̀kadà tó jẹ́ pé ọ̀kadà yẹn ló ń gùn, aláboyún wà lórí ọ̀kadà, gbogbo ọ̀nà tó ń gbọ́ ọ̀kadà ń gbé gbà kò dáa, ó lè boyún jẹ́. Àwọn oríṣiríṣi nǹkan téèyàn ń fi símú, gbogbo ìdọ̀tí, gbogbo dọ́ọ̀stì, ara àìsàn náà kọ́ yẹn ni, àbí Dr. Bisola, ara tó lè fa àìsàn nìyẹn. Àìbẹ́ẹ̀kọ́?
Bẹ́ẹ̀ni.
Gbogbo mo ti ń gbé bí tipẹ́, wọ́n sunkún bí ilé wà nítòsí ilé wa, wọ́n sun ilé ń bẹ̀, àwọn carbon monoxide téèyàn ń fà wọ́n mú, ó máa ń fa àìsàn sí ni lára. Gbogbo eléyìí là kì í ṣàkíyèsí, tó jẹ́ pé àwọn oúnjẹ wo gan ló yẹ ká máa jẹ. What kind of food should you take at what age? When you're getting old, should you take more milk? Should you take fatty food and all that? We don't actually take cognizance of this, and this actually increases the rate of morbidity. Am I right? And which may even lead to death. So these are part of what we are looking at. Hello, good morning. Okay. Àǹtí Ṣẹ́wẹ̀ jẹ́ àwọn ọjọ́ àwíkọ́ wọn ti ń kanlẹ̀kùn táwọn náà fẹ́ wọlé Dàmọ́lá Ológunfe. Yes, I want to take your parting shot before I allow you go.
Thank you very much. Before I leave, I just want to leave this recommendation for the policymakers. If you are going to achieve this SGT3 in Nigeria, we have to widen access to vaccination. And one of the novel things that have been done some parts of the world, like Kenya, like Uganda, is looking at the possibility of combining animal vaccines with human vaccines, particularly in pastoral areas. In some areas where they highly regard livestock production, they will give attention to you when you want to take care of their animals. So if you can, in those areas where people rate it that way, we can take children vaccine and animal vaccine to attract them, so that we can increase the vaccination coverage. That's number one. Then the issue of financing, healthcare financing, government has put in place issue of health insurance. People should please cooperate with government in this respect, because like Oyo State, I'm aware Oyo State also have this OCR arrangement, this Oyo State health insurance scheme, federal government has, but it's limited yet, because the buy-in is limited. So I'm encouraging our people to buy into insurance scheme, health insurance scheme, in order to make sure that the issue of health financing is made easier, so that we can achieve this SDG 3 not minding the pandemic, even though we cannot discount it, but at least it's still achievable. We can make more concerted effort in these directions.
Dr. Additional, your parting shot.
Okay. Yeah, so thank you very much for the opportunity to be here. I want to add that individually, we should also do our part to sustain the health of our community. Whatever we can do, wherever we can help, the inequality is much. We see since every day, the gap between the rich and the poor is so wide. Some people have so much more, while some people don't have at all. So whatever we can do to help our neighbors, let us do it. That is my parting shot.
Thank you very much, Dr. Additional. Let's have Dr. Ibishola. Yes, so that I started with the president, and I will conclude with the president. So, Dr. Ibishola.
Okay, so in addition to everything that we have said, I want everybody to see the world as one. The human being cannot exist without the environment, and we should also not neglect the plants and the animals. If we don't take care of the animals, they will come to our abode and infect us with their own diseases. So like Dr. Faramade has mentioned, it's important that we focus on preventive measures like vaccination and animal health. Let's respect our environment, burning of bushes, indiscriminate dumping of refuse. We need to limit all of that so that we can have a healthy environment, a perfect climate, and we can live a healthy life. Thank you.
Thank you very much. And of course, Onome Ozegbe, the JCI president.
I want to say we'll be rounding up the project on the 27th of February. We're having our medical outreach at Abala community. The innovations are ongoing. We'll be having the project. So we want people to come and see what we've done so far, what can be done. We want to follow JC Aoliole on Facebook, on Twitter, on Instagram. You can also reach me on 070-5823-6868 for contributions, for partnership and for sponsorship. 070-5823-6868. So we can do this thing together. At least together we can achieve more.
I would rather just take this as Splash FM corporate social responsibility, because what you just did, you have to get to accountant and pay some money. Well, let's say we give this to the community as part of our own partnership.
Thank you very much.
To what you have done or what you are doing to save lives.
Thank you very
because
much,
it's very, very important. Yes.
Thank you, sir.
Thank you very much. Yes, Onome Ozegbe, the JCI Aoliole president. Thank you for coming on this show.
Thank you very much, sir.
Dr. Ibishola Babashola is a family physician and a regular customer from University College Hospital Ibadan. Thank you, Ibishola, for coming. And Dr. Ibikunle Faramade, advocate of United Nations Sustainable Development Goals, National Veterinary Research Institute, VOM. George, thank you for coming. Dr. Additional from Academy Hospital, we appreciate your coming on this show. My name is Yemi Sonde, Progress Mind Media, PSM, Desmond to the G, Damola Ologunfe, Julia Anthony, Rashida Olowodon, we lájọṣe gbogbo ètò yìí Ọlọ́run bá ní jó bàjẹ́ yóò máa dùn ní kò nìkan àmàlàyé àfẹ́ ò gbọ́dọ̀ tutù tí n bá ti jàmàlàyé àfẹ́ ẹ ti mọ̀ wípé ara máa ń dán gbáà ni àbá ti dé lórí bí wúyà èmi àti Freedom Synergy Pro ètò míì tó tún gorí ètò láàmà mú táàmà fi ṣe mùkúntùn àǹtí nìkẹ́ wọ́n ti gbé pupa wọlé ẹ kú kalẹ̀.
Ogun bílẹ̀ afúnni ni wọ́n sọ olóyún abẹ́rẹ́ láì ṣiṣẹ́ abẹ́ ewé ń jẹ́ ogun jẹ́ má ṣe lògùn without doctor's prescription mo tẹnumọ́ all on doctor's attention.